Why do dental implant hurts or pain? Many of you must be having a common question in your mind. Do dental implant hurt? Do it cause pain? Yes, my friends, I, Dr. Mayur Khairnar from Precigem Dental World, your full mouth implant specialist. I'm going to cover a topic on this subject, do dental implants pain? So, before I explain all these things, let me explain you the basics. The basics by which we place implants into the jawbone. There are basically two techniques. One technique is an open flap conventional technique in which the gums are separated from your jawbone, which you can see on your left hand side, and then the bone is exposed and the implants are installed into this. Now, what are the advantage and disadvantage? The advantage is you can see the bone clearly. What is the disadvantage? It is slightly painful. It causes little bit of swelling, and the third and most important is cause slight bleeding, and it also requires suturing because you have to, that is stitches, because you have to close and approximate your gums. Whereas there is another technique which we call flapless technique. In this technique there is no need to open the gums. When your bone is quite good in width, that it can be done flapless. That means without opening the gums the implant can be installed, and it can be done with a two-piece implant as well as one-piece implants. It is relatively less painful. It causes minimal to no bleeding. So I'm going to show you in this video some demonstration of flapless technique in extraction cases and in non-extraction cases. So what is extraction and non-extraction cases? Let me explain you that. So scenario number one is the area where a tooth is already extracted, the front incisors is already extracted, the gums is very well healed, and it is now ready to place the implant. Now scenario number two is the emergency situation where the tooth has fractured. The patient cannot wait for a long period of time, so we have to extract his teeth and we have to place implant immediately. Now this is something different from scenario number one. Scenario is different from scenario 3 as well. So scenario 3 is something where you can see the front lower central incisors, it is intact, it is not fractured, but it is moving, so we have to remove it. But in all these three scenarios you need dental implants. Now what you saw is a condition for one single teeth. Let me explain you when this happens for a full mouth. Full mouth, scenario number A, where all teeth are extracted long back, the gums are healed very well, and now they are ready to receive a denture or a full mouth implant. Scenario number B, majority of the teeth in the upper jaw have been extracted. Few teeth like two central incisors are still rare. It requires an extraction and then implant placement in the upper jaw. Scenario number C is situations where all teeth are loose, infected, and they all require a dental implant by removing them and replacing with the fixed teeth prosthesis. So I'm going to cover all these three scenarios in two-piece and one-piece implants, and also in single tooth and a full mouth in subsequent videos. So if you can see this condition, one central incisor is missing, you can just evaluate how we treat this case. Now this is a very good healed areas. With the help of a one single drill, we do a placement of drilling. This is by the technique called ABC, and you can see we check the length and the anatomy of the bone with something called probe. This is the implant, and that's how slowly we place the implants into the jawbone. Now this is a fast forward video, so don't get confused. It is placed slowly into the jawbone where no gums are reflected, and it is done totally flapless. You can see how minimal bleeding is happening. There is nothing, and this is just immediately after the implant placement. So can you appreciate the healing on the day 2, and on day 3 patient is receiving almost a zirconium teeth. It looks like the healing has happened around 6 months. So that's the basic advantage of a minimally flapless approach. So you got a clear idea about a flapless approach in a healed area. Now let me give you an idea for a flapless placement in extraction socket. Now if you see this scenario, this is an extraction socket and the implants are placed flapless. Then the gums are not open, but still the implants are placed. Here the relatively bleeding will be slightly more, not much, but the pain will be minimum because we are not opening the flap, and the gums are placed exactly. This is something scenario like scenario 3. So gums are placed, implants are placed into the gums, and you can appreciate it is done very slowly and very cautiously, and that's where on the left hand side you can see the implants, on the right hand side also you can see the 2 implants. This is the healing on day 2 with that scenario, and that is the patient receiving a teeth on day 3. So you got an idea. Now let me explain you all these 3 scenarios in details. So this is a scenario of like type A, where all teeth are missing and the gums are healed. So here the implants are placed immediately. Now this is a number 2 picture is a day 1 image after placing an implant, which is a single piece implant. Can you appreciate? There is no cutting of the gums, there is no suturing, so it is as good as healing is happening perfectly. The pain in this situation is very minimum or close to no, and we do give some kind of strong painkiller, so the pain is controlled very well. So the pain is almost close to nil, and that's a patient receiving in a image number 3 on a day 3 the prosthesis. The gums and healing is fantastic. So that's a scenario in which you can see at day 1 the upper maxillary arch received an implant, that is 2-piece implants, and a front 2 teeth or 3 teeth requires an extraction. So we did an extraction for front 3 teeth, and then we placed an implant, and now you can see these implants are placed with a flapless approach. There is absolutely no cutting of the gums and the opening of the gums and no suturing. So this is done with a total flapless approach, and where you can see an image of on a day 3 where a patient have received the fixed teeth. So that's the scenario number 3. So this is again a flapless approach, minimum pain, minimum trauma to the patient. Now there are certainly some situations where we cannot avoid opening of your gums, and those are the situations where your teeth are loose or infected or anything. In that situations, we do have to open the gums. We do have to clean your infections below your root surface, and there where we have to place the implant. So still it is not a big challenge, we can still do it, but it do require some kind of sutures. There would be some slight swelling also, there would be some slight bleeding and some pain also. But there is a good news for the patients who is having this kind of a problem. Today, with the help of conscious sedation or a nitrous oxide, we are in a situation to relieve the anxiety of the patients, especially such kind of a patients, where we can easily make you painless, and this is nothing but help of a nitrous oxide. So nitrous oxide is nothing but a gas which is inhaled into the body, and where your stress levels can go down, your anxiety can go down, and your pain threshold will increase, because of which the chances of you getting pain will be very minimum. So don't worry, this is a time tested method, and it has been tested on me as well, and you can see this is me after taking a nitrous oxide. I'm just relaxing. So don't worry my friends, you are in the right hands. You will not get that kind of a problem. If you have anxiety, it is now we are ready to relieve your anxiety. You can watch our videos on a conscious sedation in future, so that it will be helpful for you to take the decisions to make that one change in your life. So the conclusion is dental implants are not painful if it is managed with the proper skills and technique. And if you like the videos and if you find it valuable, do not forget to subscribe it or share it to the people who really need it. You can also comment in the comment box. You can view multiple videos, the testimonials and the case studies of many full mouth implant patients. So with this, I am signing off. I, Dr. Mayur Khairnar. Thank you. Jai Hind, Jai Bharat.